I'm going to be after the maxillary premolars. As far as film placement, I'm going to push it in as far as I can so it ends up being on a little bit more of an angle, like that. So you just need a little bit of the sensor outside of the mouth. Before I worry about my bisecting angle, I'm going to have my cone coming so it's directed right onto those teeth. So similar to this. So I can see it's going to, almost like I'm going to take a nice picture of it. You can see it going right on like that. Premolars are teeth at the side, so where I'm going to go is at the front of the animal in order to line up my angle. It's really easy to foreshorten premolars, so keep that in mind when you're lining up your angle. So bird's eye view of what these teeth do as they go in the skull is if you stand at the patient's front, the teeth are going to the skull about like this. The front edge of my sensor is here, so that's the other angle that I need to use. So teeth are here. Sensor is here, so halfway in between leaves me about there. Okay, so what I'm going to do is I'm going to take my cone and I'm going to direct it onto my bisecting angle. Okay, so then I double check tooth, and then this is your bisecting angle. So you can see how it's lined up nicely to image those premolars. When you take your x-ray, if you find that your premolars are foreshortened, it means you were aimed too much at the film. So as far as what the cone needs to do, it needs to move the opposite way away from the film to fix that. So with this sensor, with the DR, with that one, and this size of patient, I likely got the first three. So what I'm going to do is move back and work on getting the more caudal premolars. The further back in my mouth that I get, it makes it more difficult to place the sensor. One little trick that works well to capture the last molar is if you take the sensor and you give it a little bit of a twist, just like a quarter twist, that will buy you a few more millimeters of space in the back of the mouth, and a lot of times that's all you need to image those caudal molars. So same way that we just aimed up at our bisecting angle would work well for the molars. One little trick that I find works well sometimes for the molars, instead of having the cone directed right onto the tooth that I'm after, aimed at my bisecting angle that I find from the front, what I'll do with the cone is I'll actually, instead of having it come dead onto the teeth, I'll have it coming from the distal aspect. Okay, about 30 degrees. And what happens there is when it hits the tooth, it sends that image of the tooth forward in the mouth onto the sensor. And again, that works well, especially for those tight areas in the back of the mouth.